Hennepin Healthcare Golden Valley Clinic is making it easier for COVID-19 patients to recover at home, while also be closely monitored by healthcare professionals.
At this point, we're still climbing. We anticipate that there could be still considerable increase in a rise in cases and more hospitalizations.
Minnesota continues to see a spike in COVID-19 cases. On Tuesday, the Minnesota Department of Health reported almost 6,000 cases. Hospitals like Hennepin Healthcare are full of COVID-19 patients.
We want to keep those inpatient beds available for the most sickest of the sick.
Patients who have mild symptoms are sent home to MIN.
I was scared for a while. I was really scared.
70-year-old Stanzer Knox was diagnosed with COVID-19 2 weeks ago.
Sometimes I was hot and sometimes I was cold.
But he didn't need to be hospitalized.
Coughing a lot.
So we give them a hand sanitizer, an oximeter for them to measure their pulse oxygen levels.
Doctors enrolled Knox in the Hennepin Healthcare COVID-19 home monitoring program.
We also send them a mask and instructions on how to use the machine, and then also just a bunch of different food in here that they can use during their illness.
He was given a care package with food and medical equipment to check his oxygen level.
And my oxygen right now is 100%. That's the best it can be. With COVID-19, there's something called silent hypoxia, and that's where your oxygen level can drop very quickly and maybe without you even realizing it. And so having that pulse ox machine at home allows you to catch that before it happens.
Each day, Knox would check in with healthcare professionals.
Every time I gave him a reading, he was going, "Oh, you're doing great."
He needed someone with the medical background to tell him, like, oh, no, he's actually okay.
He says the program gave him peace of mind, knowing he was being closely monitored.
I am very thankful for them people. They call me every day, checked on me, and asked me what my vitals was. So I just wanted to sit and tell them, thank you very, very much.
Healthcare professionals say it's also comforting in knowing their patients are doing well and on the road to recovery.
And he was really appreciative of the support that he received from our team.
In Golden Valley, Sonia Goins, CCX News.
After 5 years of injecting cortisone to an old knee injury, Erin Mastro realized she needed a new treatment.
We just got to the point where the cortisone wasn't helping anymore, and my PA had mentioned that I should probably look at needing to do a replacement.
Mastro went to Abbott Northwestern WestHealth in Plymouth for help. That's where she learned about the hospital's newest surgical tool called the Stryker Mako Robotic Assisted Arm.
It's a robotic assistant device where it aids the surgeon during surgery. So your surgeon is still doing the operation. The robot just allows him to do it in a more perfect manner.
Dr. Bishoy Gad says the robot allows doctors to plan how to exactly cut the bone so the implants can fit perfectly.
Where with standard instrumentation, you can't exactly put the implants where you want them. You're kind of limited by the instruments.
Because implants are able to fit perfectly, doctors won't have to make additional cuts in the surrounding structures, which can cause pain and increase bleeding.
You'll get information about, for example, how tight the ligaments are on the inside of the knee. And based on that information, the surgeon will adjust the components to adequately fit the patient.
Patients have reported less pain, requiring less narcotics and faster recovery.
Therapy has been great. I will say even my physical therapist has noticed that my recovery is so much quicker.
The procedure also allowed Mastro to go back home on the same day of her surgery.
Everybody was shocked and surprised. Everybody thought for sure I'd be in the hospital overnight, but it was nice because I got to come home, my kids got to see me.
Gad says he knows more about his patients than ever before through the new technology, and he's excited to offer this transformative tool.
All surgeons in general are perfectionists. We want to do the absolute perfect job. And I think the robot is just a really good tool to help us achieve that goal.
In Plymouth, Pafua Yang, CCX News.
If you happen to be strolling down the street in Hopkins and are near the Hopkins Center for the Arts, drop in to walk through the lobby gallery and catch Erik John Olson's exhibit.
All of the works on display in Erik's show are made out of quilted plastic waste. Much of this waste is plastic that we don't normally see. It's kind of a hidden waste. Bags that produce come in, delivered to grocery stores that they then dispose of.
Erik himself wastes nothing in his creations.
Erik's process is very efficient. He uses the scraps of scraps. So as he's making these wonderful art objects, he keeps all the offcuts and then uses those for other pieces or for the batting or stuffing in the dimensional work.
Olson seeks to raise awareness of the amount of plastics that we use that then end up as waste in the environment.
On the face of it, it's maybe lighthearted and a bit whimsical, but you scratch the surface and it gets very serious very quickly.
You may even recognize one of his pieces from someplace before.
She Wears Green Velvet was a piece that was in the Minnesota State Fair Fine Arts exhibition this year. It won an award there.
Gallery hours are Monday through Friday, 8 to 8, Saturday, 10 to 8, and Sunday, noon to 5. All of the work will be up through Saturday the 28th. In Hopkins, Neil Persley, CCX News.